Today's episode is sponsored by Vitality Health RX Supplements. Whether you're an athlete, a busy professional, or just someone looking to prioritize health, Vitality Health RX has what you need. With premium ingredients and rigorous quality control, their supplements support your body's natural functions. Visit shopvrx.com and use code FEELGREAT15 for 15% off your first order. Thanks to Vitality Health RX for sponsoring this episode. Now let's dive in.
Welcome to the Feel Better, Feel Great podcast, episode 130. I am Dr. Andrea McSwain. Today we are going to be talking about the organ performance for the lungs. And as we delve into this topic in the podcast, I want to remind you that while I am a medical professional, the information here is for education purposes only. It is not a substitute for personalized medical advice. Please consult your healthcare provider for guidance on your specific healthcare needs. Now let's embark on this journey of health education together. I want to present to you today conventional and holistic evaluations and treatments for the lungs, and then also consider the mental and emotional aspects of lung health. When we look at the conventional evaluation and treatment, we recognize, first of all, the role of the lungs is for breathing, oxygenation of the blood, and removal of waste. It is a very important organ of elimination. When people have respiratory issues, we recognize that that has to be addressed immediately. So when we look at history and physical exam, oftentimes symptoms are obtained. Are you short of breath? Are you coughing, wheezing? Is there any chest pain? And then looking as well at the heart, because cardiovascular and pulmonary problems go hand in hand. Now that might be a little bit more of my bend. Oftentimes in a conventional history and physical exam, the family practice doctor is really honing in a lot on the symptoms related to the lung, and then we'll occasionally address nearby symptoms. So really, they're going to also obtain a patient history, so smoking history, pack per day, occupational exposures. So were you a coal miner? Were you in a factory with a lot of chemicals? Are you a hairstylist using dyes that are chemicals and go into the lungs, for 10, 20, 30, 40 years? So that's good to obtain the detailed history, and then possibly even listening to the lungs with auscultation in the different lobes. There's 5, 2 on the left and 3 on the right. And then there's testing that can be done for the lungs too. There's pulmonary function tests. So how well can you breathe in and out? There's often this little tiny inspirator to see if you can get the ball all the way up or how far up. There's a lot of expensive machinery as well to measure pulmonary function tests. And you look at rates of flow and potentially gas exchange. Now, another important test is chest x-ray. And when you have the imaging of that, it detects infections, tumors, and other abnormalities. And then CT scans are much more detailed, looking at lung structures, lung cancer, pulmonary embolism, if looking for pulmonary fibrosis, looking for different shapes of the lung fibers. And then we look at blood tests to often evaluate CO2, and this is commonly done. The CO2 range is quite wide. Remember, when you look at labs, you're looking at population reference ranges and not optimization. And the population reference range for CO2 is quite wide. It's like something usually like 22 to 30. And less than 22 is very acidotic, and over 30 or 32 is actually really about being at COPD, or a chronic obstructive pulmonary disease, and we'll get through that in a minute. But I like to think about CO2 as that sweet spot. Where are you actually releasing a lot of CO2 through the lungs with exhalation? And then also, where are you using CO2? Because it has a lot of important mechanisms in the body. So that is a nice little sweet spot at 25. That's my Goldilocks number for CO2. And if it's high or low, I encourage some breathing techniques in my practice. So that's something to think about, and I'll elaborate on that in a little bit. The other thing is, I had a patient come in recently and was like, "Can you tell me my blood gas tests?" And because they wanted to know if they were acidotic and such. And I said, "Well, that's rarely done. It's usually done in the ICU where we obtain arterial blood gases. That's in a really intense situation." So I did want to address that it is done, but it's rarely done and definitely wouldn't be run of the mill. And then another procedure slash test that can be done is a bronchoscopy, where I actually go in with a tube down the trachea and into the lungs to look at the bronchioles. I want to take a minute now to explain the anatomy of the lungs before we proceed. So the anatomy of the lungs, a lot of times people don't understand that the lungs have, as part of the respiratory system, the lungs have the nose for filtration, then the mouth also allows air in and out. Then you get into the back of the mouth, then the trachea. Okay, and this is a very hard structure. It's really that way, so there's very little collapsibility available to the trachea. That's important. Then you get into the bronchioles, okay, and those are little tiny compared to the trachea, right? You branch into this like tree formation in the lungs. And so the trachea to the bronchioles, and then you get into the smaller different fibers until you get into these really thin, almost like lace structure that can be observed in CT, particularly if there is some fibrosis. So there are fibers that go all the way down to maintain the structure of the bronchial tree down to these little tiny sacs that are called alveoli. And so alveoli, they kind of look like little grape pockets at the end of the bronchioles and the bronchial tree. And what they do, that's actually where you have the air and the gas exchange. And so that's a big migration down. And then of course you have the lobes, so they function together, but then they have some independence with sequestering themselves in these larger kind of subunits. So the alveoli are very important because that's where you have the air exchange. Within the alveoli is a gas or a substance. It's not a gas, it's more of a substance, like a film, right? So almost like an oil or a lubricant. And what that does is allow for the alveoli to not completely collapse on itself. And so when the alveoli don't collapse on themselves, then you can have this opening and kind of mostly closing. Now, if the pressure inside the lungs, for many reasons, starts to get too much and people develop something particularly like emphysema, because of the thickening, you won't be able to really have that natural elasticity that's present in the alveoli. And as a result, a lot of people will learn to breathe differently with pursed lip breathing. And as a result, that way the alveoli won't collapse. So if you find that you are pursed breathing, which is this, let me do it, right? Your lips are pursed, then we probably are recognizing that there is some problems that are going on for air exchange or gas exchange in the alveoli. And those are then leading into some other common conditions. So I kind of explained emphysema there, and a little bit about chronic obstructive pulmonary disease, or COPD. And I often wondered, how can you tell the difference between COPD and emphysema? And I think this is really kind of a classic description where people go in one of two directions, but both are related to respiratory dysfunctions and usually a lot of toxic exposures like smoking or environmental exposures. When we look at COPD, though, they end up being kind of blue bloaters. So COPD, people are stuck in this kind of exhalation. They're very full. They're always like, and then when you have people with emphysema, they're pink puffers, and they end up going like this. So if you're looking at how you breathe in the mirror, you might want to appreciate a little bit of some of the movement of the chest cavity to see if you're actually having expansion and contraction of the lungs, or are these structures kind of moving the air in and out. So that's important. That's also important with asthma. So when people have asthma as kids, usually it's a problem that they often grow out of, right? Because the airways are very small, and as they grow, they don't have such small bronchioles. So usually asthma is an upper airway or bronchial problem. The bronchioles get inflamed, and then they spasm, so they do not allow for the transport of oxygen into the lungs. So it can be very severe, of course, because there's not a large window there for therapeutics. A lot of times the treatment with that is corticosteroids to keep those bronchioles dilated. So when adults have asthma, I have to say, kind of cautionary tale there is also need to be looking at the heart. There's been a new onset of adult asthma being diagnosed, and I really feel like that's more about a preliminary concern for cardiovascular disease that's getting missed, particularly if you're a postmenopausal woman. So if you've been diagnosed with asthma, it's really important to also consider if there's a heart concern. There are other common conditions. So I've mentioned asthma, COPD, emphysema. There's other conditions that we can that are common for the lungs. So pneumonia is an infection. I will talk about pneumonia another time because there's a lot to learn about pneumonia, so that you can actually feel better and recover from pneumonia, so it doesn't just keep getting worse. And that's a really very important point that I will say about pneumonia is a lot of times people have recurrent pneumonia. They're usually people in the fall who get pneumonia, and they get it over and over and over. And then there are these dips in health that exacerbate the pneumonia. So, of course, longer antibiotics, multiple courses of antibiotics, and sometimes then leading into hospitalizations. So it's important that we can recognize how to reverse pneumonia so that we can get people off of antibiotics, keep them out of the hospital, and such. Then there's, of course, lung cancer. Lung cancer is a common condition for the lungs, usually due to environmental exposures and accumulation of toxic waste within the lungs themselves. It is related sometimes to genetics. There are other things that can be also evident, and one of them is pulmonary fibrosis. I won't elaborate very much on pulmonary fibrosis, but if you're finding it very difficult to breathe, or if you keep getting recurrent pneumonia, or you can't have anything necessarily diagnosed from this or that, make sure to talk to your doctor that could this possibly be fibrotic tissue developing in the lungs, because that is often missed as a differential. Okay, so of course there's many treatment approaches. As I mentioned, medications like bronchodilators and corticosteroids for asthma and COPD, that's at least till you get to the root cause. Okay, so we're going to talk about that a little bit later in holistic approaches. Of course, there are antibiotics and antimicrobials for things like pneumonia, antiviral medications for viral infections, and these are all if you're seeing a conventional approach. Also for lung cancer, there's the classic triad of chemo, radiation, surgery. But I want to get to those in a few minutes. Oxygen therapy. So if you do have a severe lung condition, it is important to use oxygen, an oxygen tank. Some people will run it during the nighttime. Some people will run it before they have exertion. There's also a biohacking technique for that, where you use oxygen as a support while you're exercising to improve the amount of oxygen supply you have. That's very important as well for chronic fatigue. There is lifestyle modifications, of course. These are conventionally accepted ideas. So people are encouraged to stop smoking. They're told to stay indoors, right, to avoid pollutants and allergens. And then there are some pulmonary rehabilitation programs to improve lung function and quality of life. Those I have not seen to be successful, because oftentimes they are looking at how to make the lungs work harder, but the lungs are working hard enough. So I think that's a little bit of a problem with that idea. So those are some discussions on conventional. Okay, and then I'm going to go into holistic. Obviously, the lungs are really important, so there's a lot of information here. So looking at a holistic approach, first of all, a detailed history is really important. It usually goes a little bit deeper and a little bit further back. So it's not just diet, lifestyle, environmental factors. I worked with a patient who had developing adult asthma that was getting progressive and really couldn't understand why, but we actually recognized that at some point in her life, when she was, mid-20s or something, for about 10 years, she lived right next to an airport and she was running underneath the flight line of the airplane. So she was getting a lot of exposure that she didn't even put together until she was struggling with her lungs several years later. Then, of course, we want to look at lifestyle modifiers, so stress, sleep, overall well-being, anxiety, and then, of course, there's diagnostic tools. But I value all of those. Then I want to kind of put a little bit of a different spin on this, because I want to make sure that you're thinking about differential diagnosis. And I mentioned that with pulmonary fibrosis. But I want to talk about two highlights of differential diagnosis that I would say are very important. And when you're working with a holistic medical doctor or a holistic osteopath like me, the idea with a differential diagnosis, right, is basically brainstorming what could be causing this problem and thinking about all the systems that relate to the lung and how the lung symptoms are being caused possibly by other things. So in medicine, we talk about horses and zebras. Horses are common, zebras are rare, but I'm not asking you to think about rare things. I'm just asking you to think about more horses. And I think that is the holistic approach when it comes to the lungs, is to not just think about waiting till you get COPD, waiting till you get emphysema, waiting till you get lung cancer, right? Actually rehabbing the lungs is important because they're symptomatic, but what is the reason? And so I want to look at a differential diagnosis and work with you on that. And I would say two highlights of important differential diagnosis in this case would be food sensitivities and lung symptoms. And the second is rib dysfunction. Food sensitivities, and I've talked about food sensitivities before. Please reference some of my other podcasts in that regard. But basically, think about the 7 most common food sensitivities because they are very much triggering an inflammatory situation. The 7 most common food sensitivities are gluten, sugar, corn, peanuts, eggs, soy, dairy. And so it is important to do 7 days without all of them and see if you're better. For some people, that is a game changer. And why not do that? Because then you can breathe better. As you reintroduce some of those foods, you might find the one that you're actually really sensitive to that makes it very difficult for you to breathe because it's very inflammatory for your lungs and your whole body. Second is thinking about N-acetylcysteine supplementation. This helps reduce mucus, improve lung function, and it's been around forever. It's called Mucomist by some manufacturers, and you can find it in a lot of places. You just want to make sure you get it from a good manufacturing source because it's not all the same, and oftentimes you'll find with these supplements that they actually have the fillers that are the triggers of corn, dairy, soy, da-da-da-da-da. Okay. And then looking at anti-inflammatory foods rich in fruits and vegetables. This is very important because that helps with the blood supply. Remember we talked about the alveoli. there's actually those little blood vessels going in to bring in the CO2 and pick up the oxygen. So if the blood vessels are having an integrity issue with inflammation, then you're going to have a lung problem potentially. And fruits and vegetables do really well to support the integrity of the blood vessel wall. All right. And of course, hydration and oxygenation. But hydration is very important because the lungs need that mucous membrane health. And we can often tell if we're dehydrated from drying of the mucous membranes. So that's in the nose or the mouth, or we get thirsty in our throat. But that already means there's some dehydration issues affecting our lungs. The other one is rib dysfunction. Now, I'm sure that you have met someone in your life that has struggled with being able to breathe because a rib is out. The ribs are chaos when they get restricted. They do need to move freely because they will contort in and of themselves. They will restrict one side or the other. They'll push forward in the lower part. They'll compress from the top. And the rib is the cage to protect the lungs. It's also to keep us up high and structured. And so if the ribs are having problems, either in the structure of the bone or the muscles around every single rib, there's a muscle. Also, the diaphragm could be constricted, and that's an issue for opening up the diaphragm. And then the other one is that oftentimes people start over expanding an inhalation before they've actually given a space with exhalation. So I think that's a really important consideration when you're looking at a holistic approach, is to really incorporate those differential diagnosis. And again, I don't think you're looking for zebras. I just think you're looking for more horses. What are more common differential diagnosis when you're looking at lung symptoms? The next section is on mental and emotional considerations with the lungs. I realize that a lot of times people are kind of stuck into a mental diagnosis of anxiety, when actually there's a lot of compression or inflammation in the lung cavity, and then that is causing people to feel this lung symptom that is very overwhelming, and then that leads into behavior that is apparent of anxiety or difficulty with the situation, when in fact it's actually an issue more like hyperventilation. So anxiety and panic disorders, while very real and completely validated, is really something else. Let's look at other horses, right? And look at maybe some respiratory symptoms and enlarge that differential diagnosis before just pigeonholing people into that, oh, this, what I say, the end of the road as well. Like, oh, that's an anxiety issue or that's a panic disorder. And really, we're finding they're hyperventilating because they have something going on affecting their lungs, which freaks the body out. So looking at those ideas helps, again, expand our approach. It helps understand that there might be a reason. So finding a reason is the same as root cause analysis, at least close enough to be, said that way. So, of course, we want to look at other things like mindfulness, how to breathe. I have some YouTube videos on this. I'm actually pretty adamant that a lot of ways we've been taught to breathe can actually do us more harm than good. And I will tell you the littlest story as we wrap up. And I remember, I don't even know if I should share. This is so funny. But I remember I was 14. It was my first week of 9th grade, and my daughter's starting 9th grade this week, so I guess this is a good thing to remember. But I was 14, and it was Friday, last class of the day on Friday. So started on Monday, was the first week, end of the first weekend. I forgot my Spanish homework. So I once forgot my homework in the 2nd grade, and I was sick to my stomach, and then I forgot it the very first week of 9th grade of high school. I was certain I was doomed for life. And I started to hyperventilate, like completely lost it in Spanish class. And so the nurse came to retrieve me, and she handed me a paper bag. And then she said, breathe into this paper bag. So as we're going down the elevator in the high school to her office and the nurse's clinic, I then thought, well, now I have two problems. One, I can't breathe. And two, I don't know how to kiss a boy. She said, like you're kissing a boy. And I was like, I don't know how to do that because I was 14. And I thought it was like, now I have two problems, which made me even more anxious and hyperventilating. But I survived. And I just wanted to tell you that it's very real when you have these things going on. And then the emotional components of lung symptoms. Anyway, all the best. And please check out the podcast and comment. If you are struggling with these things and you want more information, let us know, because we definitely I want to make sure, and our team wants to make sure that we're getting you information that's really vital to your health and well-being. Thank you.